work in Kansas City for the Veterans Health Administration, and right now I'm able to shadow executive leadership within the hospital and just learn how different departments work, and so that hopefully I can be a healthcare leader in the future.
So I live in Washington, D.C. My ultimate career goal is to be a pediatrician, but in the meantime, I want to build my professional experience in the health field. MHA, from where it was coming from, the concentrations were interesting, and it seems like it's multidisciplinary because it is health administration, so you're covering all the bases of health, and I felt like this would be a good fit, and it was affordable. So I went for it, and I'm really glad I did.
I went to Duquesne here as an undergrad. When I came here at Duquesne, I believe it was 30-1, and I really liked the small class size compared to a bigger university. I still like the intimacy of having, a teacher to 3 to 6 students, because I feel like they were there for me, they really cared, and that's kind of why I picked it. Also for their competencies in finance. There's some towards risk management, but the population health one was the one that really caught my eye.
A long time ago, I would have found online learning to be terrifying because I'm used to that in-person interaction. But when I found out this was online, I thought it would be flexible because I'm already working. I can't just quit my job.
Since I made the move to Kansas City, even prior to that, I was working at UPMC 40 hours a week. And because it was online, you can go home, you can cook a meal, and then you go to class at 6. And so it did provide a lot of autonomy and a lot of flexibility.
I'm very appreciative of just having the support, because I don't have strong experience in the healthcare field, and to take on this master's program, which is commonly for people who are already in their careers and whatnot. But one of the representatives here I talked to here at Duquesne was super supportive and was like, it's okay, this is what it's generally for, but you can still do it. And I was just like, why, thank you. I'm always focusing on what I'm lacking, but what everybody saw was what I could potentially do. So that's what really stood out for me.
So I think it's not only provide me the proper credentials for me to excel forward in an executive leadership position in the future, but also I think staff has been amazing with providing me skills, not only to just have the general knowledge of how to view stats, understand finances, and then also the communication aspect of it, making sure that not only are you a leader that understands all this data, but also that this is healthcare, this is about people.